So there's tinnitus with the chirping, buzzing, bacon frying, and then there's pulsational tinnitus.
Pulsatile tinnitus.
Pulsatile.
Pulsatile, yes.
Oh, there you go. So can tinnitus, I have a statement, tinnitus can be cured.
That's a trick question, because if you have wax and you take the wax out, if the wax is causing the tinnitus, then yes, you can cure it. 9 times out of 10, though, that's not what we're dealing with. Most people are going to come in and they've had everything ruled out medically. There's no wax in the ear. There's nothing that's medically wrong, and they still hear this buzzing or whooshing. In that case, well, yet there is a cure. We just don't know what it is yet. We're searching diligently for that. There's technically no cure. That's not the right question to ask, though. The question you want to ask is, can I get relief from my tinnitus? Yes, that's a resounding yes. We can absolutely.
I love that. Yes, doctor,
Yes.
go for it, can give you relief. I think that's really important.
Yeah.
So let's go to the next one. Tinnitus can be related to loud noises.
Yes, and many times you can actually directly correlate it. I used to work for a subcontractor to a military company where we measured and analyzed noise of fighter jets, of our service members that were on aircraft carriers, underneath the wings with the jets going right over them. And when they would come off of the boats, they'd not only have hearing loss, but even more impactful was the ringing in their ears because of the loud noises that they were associated with. So, loud noises definitely can cause tinnitus. It can also cause hearing loss, which is why it's important about the visual aids. Let's make sure you protect your hearing if you're ever exposed to really loud noises. So, for example, if you are standing about 3 feet away from someone, like an arm's length away from someone, and you cannot understand at a normal conversational level, you're in too much noise. Turn the noise down, put some earplugs in, or limit the exposure if you can.
So those are custom plugs. Those are not
plugs.
hearing aids.
No, these are not. Now, this is a hearing aid, which comes into play with dealing with or getting relief from your tinnitus. But these are just custom earplugs. And you don't have to use these. You can use ear muffs. You can use little foamies where you can roll them up, pull your ear out, push them in.
Yeah, we recommend those, right?
Yeah, well, I mean,
And the foamies, those
the
can
best
get stuck.
The best hearing protection you can get is the one that you're going to wear. So whatever's most comfortable, and 9 times out of 10, this is going to be more comfortable.
Do the foamies work?
Yes, absolutely.
Huh.
They do.
I thought that
As long as you use them properly. Now, if you're using the hearing protection correctly, the foamies, the little yellow ones, when I'm looking straight at you, you should not be able to see them. If they're poking out, they're not in properly. So you really have to pull on your ear and kind of push it way down to, it feels like you're going to your other ear to get them in properly, which can be difficult to do. These go in much more easily, and they give a more reliable protection than the foamies. But
so this is more for the prevention.
correct.
Okay, and then there is a hearing aid. Is it specifically made for tinnitus, or helps with tinnitus?
Well, they make them specifically for
They
tinnitus,
do.
but more often than not, it's going to be both one for amplification of hearing and ones that have tinnitus rehabilitation programs in them, just like these. So I'd say probably 9 times out of 10, I'm going to recommend one of these for people that do have tinnitus that need to get relief from it, especially if they have hearing loss. What you do is put a hearing aid on, and not only are you hearing better, but then we also compete with the sound in the ear such that you get relief from it. But there's more to it than that. There's a very specific way that we program the hearing aids in order to give you relief from the tinnitus.
So what if somebody just goes like to one of the big box stores and looks for their tinnitus relief, or calls on there's now TV, like Home Shopping Network sells hearing aids. How would you be able to help somebody versus that?
Good question. So imagine tinnitus as an itch. Okay, so if your hand itches, what do?
Scratch it.
Right? Yeah, but you're not doing anything about the itch. What you're doing is interrupting that signal going from that point on your hand to your brain, and you're stimulating nerves around it. So when you scratch, you get relief from it. Tinnitus is like an itch in the ear. And if you're like me, I've had tinnitus now 20 years. Right. I try to scratch it. It never works, okay? The only way you can scratch the itch is with sound, and specific sound. Now, imagine that itch on your hand it's really raging, and you want to get relief from it, so you scratch your legs and your torso and your head. It's not going to work because you have to target that specific area. So when you scratch it, you get relief. Tinnitus is no different. So we need to identify what part of your ear the tinnitus is coming from, then develop a sound specifically to that area such that we can scratch the itch. if you will. So that's why we usually use programmable hearing aids, so that we can control the sound that's coming out of it in order to get you relief from it. So over-the-counter ones, maybe you'll get lucky, but chances are you're going to need something that's programmed a little more specifically.
Okay, myth or a fact? Tinnitus is subjective, or only subjective.
Yeah, it's a myth. So most times it is subjective, meaning that the sound that I have in my ears right now, which is in about 5400 hertz and 5200 hertz, subjective. I can hear it, you cannot hear it. There are times where it is objective, where I could put my ear up to your ear and hear it. Usually if there's a hole in the eardrum and you have some air escaping, but that's very, very rare. If you have objective tinnitus, then we likely can fix that medically. You have to be seen by your ENT to determine that, but most times it's subjective. So no one else will be able to hear it but you.
Wow. So myth or a fact, tinnitus can be so bad it will prevent or could prevent sleep and or daily activities.
So if you could come into my office when I'm dealing with anyone that complains of tinnitus, they'll answer that for you. Yes, it absolutely interferes with your life. It interferes with sleep, and it interferes anytime you're in silence. You really have two enemies when you have tinnitus. Number one is silence. So when it's quiet, it gets really loud. And number two is stress. If you get stressed out, it's really going to start coming up more.
How does stress flare it?
It activates your whole body. You're more aware of stresses in your life, and then when you're more aware of it, it just has a way of making that ringing really come to life. So we avoid those, and what we try to do is get rid of those. Stay out of silence, easy enough. Get a hearing aid, turn on a radio, put on a box fan. Avoid stress, and there's specific ways we can do that too, and that's part of what we do in our clinic here is we teach people not only how to use sound to their advantage, but how to use cognitive behavior therapy in order to reduce the stress, so that you get relief from the anxiety that the tinnitus is causing. The stress doesn't necessarily cause the tinnitus to get louder, but it causes your reaction, which can be anxiety, frustration, annoyance, to really, really increase. So you kind of key on that sound even more. So what we do is try to reduce that by teaching cognitive behavior therapy methods.
So my next fact or myth, ignoring the sounds is a good way to manage it.
I'd say that's not entirely true. While many people are going to try to say ignore it, it's very difficult because, okay, my tinnitus is loud, all of a sudden I hear this ringing, man, that really bothers me, so I'm going to try to ignore it. What you actually wind up doing is wind up paying attention to it more, then it gets louder.
Right.
When it's louder, it annoys you. It annoys you, try to forget about it, wind up paying attention to it. So it's a cycle, okay? So what we have to do is break that cycle. I'd say more than trying to ignore it, what you need to do is understand it. What is it? And I'm at a point now where I'm thankful for my tinnitus. It actually teaches me things sometimes. I mean this legitimately. Even at work, if I do get stressed out, guess what happens? Beep, it's really loud. And then I'm sitting here thinking about it. I'm like, oh, wait, you know what? My tinnitus is really loud. I need to calm down. Let's go sit in my booth. I'll shut the door where it's nice and silent, and I'll shut my eyes and breathe in 4 seconds, hold it for a couple, and do deep breathing exercises. And then the tinnitus, even though I still hear it, the reaction I'm having to the anxiety fades away.
So
that's part of it.
Can yoga and meditation be part of this
Absolutely,
treatment?
absolutely. It can absolutely help. And there's no one specific way. It's like a jigsaw puzzle when it comes to dealing with tinnitus. You know, we have to put the edge of the puzzle together by getting an audiogram, by seeing the ENT physician, making sure you're medically okay, and that's the outside portion. And then we have to get these other little pieces of the puzzle together, turn them ever so slightly till we can see the full picture. And everybody's picture is going to be a little bit different. So it takes time, it takes effort, but there's definitely relief to be had once you understand these portions or the particulars of your tinnitus.
So do you customize your plans with each patient?
Absolutely, you must. Yes, there's no other way. There's no one cookie cutter solution to tinnitus, which is why it can be time intensive, which is what we do in our course. You know, we spend time, we go through a case history, we ask questions, we try to understand where it's coming from, and not only where it's coming from, but what in life what are triggers to this, and then how do we deal with those appropriately in order to get relief from the tinnitus.
There's a neurological component to this.
Oh, it's all neurological. Well, I shouldn't say all, mostly neurological, because you hear with your brain, not your ears. Right. Your ears are just the mechanism to get the sound to the brain. Then all the processing occurs there, and that's how we treat it. It's from the processing portion.
It's very interesting. But and it is a real serious matter. What was the movie? I don't know if you even want me to go there, but the Lady Gaga movie.
Yeah. No, Born, was it Born to Be a Star or something like that? I don't remember.
Okay.
I've actually never seen it, but I had a colleague that did see it, and we discussed that because tinnitus is a big portion of that Bradley Cooper movie.
Right. So how about this one? Tinnitus and hearing loss can lead to other health issues.
Oh, absolutely. So imagine that you start to have hearing loss, and it's at the very beginning stages, but you're still going out with your family, you're having fun in a restaurant, you hear a joke, everybody laughs, you thought you got it, but you didn't quite, so but you're still laughing. Ah, ha, ha, ha. It's funny, right? Next time you go back, you hear another joke, and everybody else laughs, you didn't hear it, you just don't bother laughing anymore because this is getting old. And then eventually you stop going to the restaurant because you can't hear anything. When you stop going to the restaurant, let's stop going to church, let's stop going to hang out with people. You start to socially isolate yourself. And when that happens, other things happen, depression, which can lead to heart issues, which can lead to many, many other health issues. So we as people have to have each other. We're connected. And one of the main ways we stay connected is through speech, through communicating with one another. So when it's difficult to communicate because of hearing loss or something interfering with that being tinnitus, we need to do something about it so that we can reconnect and thus prevent a whole slew of bad health issues that could occur.
And the last thing I have is there are no ways to manage it.
Yeah, that's obviously not true.
Right.
No. We have developed a very unique course called Tinnitus 101. It's kind of an introduction to tinnitus. It's based off of peer-reviewed data developed back in the late 80s, early 90s. We know that using sound therapy and cognitive behavior therapy mixed together with education, that over the course of time, it can be anywhere from 2 weeks up to 2 years, we can reduce your noticing tinnitus by 40% or greater in 80% of the population. And I mean, it's peer-reviewed.
That's huge.
That's the science. It is. Anything in medicine, if you can have those outcomes, it's pretty amazing. And we know this from a guy named Paul Yastreboff, Stephen Tyler, University of Iowa. They developed all this stuff. And I've had tinnitus for 20 years or so. So I've looked into all of this, and it affects me directly. So it works. It works for me. It's worked for many, many of my patients. And that's what the message is. We know we can give you relief. You just have to reach out to us to start the process.
It's a painless process, too.
Physically painless.
Right.
Emotionally, mentally, it can be, but we work through that. And it's rocky. Sometimes it's going to be good. Sometimes it's going to be really bad. It's going to be up and down, but the general trend line is going to go down to where you're not noticing your tinnitus as much because you understand what it is. You've demystified the fact that, oh, hey, it's not a tumor. It's not a horrible disease. You understand what it is, and it's just sound. Sound can't hurt you. It's not possible. It's not going to hurt you. It's part of you. So you accept that and you move forward with that, and then it doesn't bother you. Even though you still hear it, it doesn't bother you. And therefore your anxiety is gone, you can regain your life.
Wow. Well, as always, we hope that we've brought you, value and given you lots of information and something you can actionably do if you or a loved one or somebody you know is suffering. Right?
Mm-hmm. Absolutely.
Suffering is the word. So you won't die from tinnitus specifically. Maybe some side effects of it would cause you to maybe lose hope. But there is hope, and there's relief. Dr. Goforth, we are so lucky to have him on staff at the ENT Institute. He's really leading the way with the tinnitus relief group. Mm-hmm. We also have a Facebook group. It is the ENT Institute Tinnitus Relief Group. It's open to anybody who wants to go and follow it, and you'll be adding new content in on a regular cadence, regular basis. But if you need us, you can reach out to us, and we can answer questions for you. And you can certainly call and make an appointment with Dr. Goforth.
So we run the course, so we're targeting one a month. The response has been overwhelming, so much so that I really have difficulty running one-on-one sessions. We group it together now in a class. In this class, it's 2 hours. It's the beginning point. We give you a toolbox. We give you what's needed to start the journey down the path towards healing. And for probably 3/4 of our patients, that's all they need. That's where they need to start. For another 25%, they may need a little more attention. That's when you call, you come in, and we can do a more one-on-one session and point you in the right direction and really get the relief that you need. But yeah, there is hope. That's the message. There is absolutely hope. I'm a testament of that. I have dozens and dozens of patients that would say the same thing. Don't give up. And if you know someone that's significantly affected by it, or even if you yourself, you can't fall asleep because of it, call us. Let us help you.
Absolutely. And as always, if you have any suggestions or topics you'd like for us to cover, we're back up live. We're happy to be here for you, and we hope that we're able to give you some valuable information each week. Have a great day. Thank you so much for being here.
It's a pleasure to be here.
Appreciate it.